Good afternoon. Good morning to you if you are on the West Coast. Thank you for being with us again. My name is Jose Leon. I am the Chief Medical Officer at the National Center for Health and Public Housing. And with me is Fide Pineda Sandoval, who is our research assistant and who will be presenting today on the AMIGAS program and all the materials included in this CDC's program. Thank you so much for being with us. And before we get started, the National Center for Health and Public Housing provides training and technical assistance to community health centers, specifically those located in or immediately accessible to public housing. The last session, we had a brief overview on some of the topics on regards to cervical cancer prevention. We reviewed some of the prevention methods, and we discussed and had a brief discussion on the AMIGAS program. Can we go back to the previous one? Thank you. For this webinar, this is a live session, so all the attendees are muted. If you have any questions, we are going to have a 10-minute Q&A session at the end of this activity. You can either use the chat box and submit your questions, or you can use the raise hand icon and your line will be unmuted. Now, can you just go to the next one? Thank you. So, before we get started, I would like to ask the audience if there is any questions. We can give 15 seconds if there is any questions in regards to the very first module that we discussed, specifically on the HPV infection, the use of the vaccine, and the other cancers associated to the HPV infection. So let's pause for a moment and have 15-second period just to make sure that there is no questions regarding module 1. Is there any questions in the queue?
We have no questions at this time.
Thank you so much. So for this time, for this session, we are going to review the AMIGAS materials. Again, this is a Centers for Disease Control and Prevention evidence-based program. And without further ado, I will turn it over to my colleague, Fide Sandoval.
Thank you so much, Dr. Leon. And I'm very happy to join this presentation today and be able to provide to you guys this information. So for today, we're going to be learning about the responsibilities of a community health workers. In regards to the AMIGAS program, we're also going to talk about the AMIGAS Toolbox and how community health workers can be effective cervical cancer screening promoters. So first, we need to talk about what is a community health worker. I know we already have some community health workers listening to us, but this is just something that, you know, we always want to make sure that we touch base on, just to make sure that everybody's on the same page, also in regards to the AMIGAS program. So community health workers are frontline public health workers who is a trusted member or has an unusual close understanding of the community that they serve. So this is a very important definition, mostly because it defines and explains very clearly what is one of the main responsibilities of a community health worker. So they do have to have some type of a trust within their community, and they also have to be known within their community. They're experts in reaching vulnerable populations, low income and underserved members of their populations. They're instrumental in bridging the gap between local communities and bridging the gap between local communities to needed health services. And they work in a wide array of tasks and environments. And they're very effective in helping healthcare systems to address the social determinants of health. So in this case, with the AMIGAS program, we will be addressing the social determinant of health of increasing access to care for Hispanic women. And they also work in urban and rural environments. So what does it entail to be an effective community health worker? So when we go over the AMIGAS program, these are some of the tips that they provide, like a guide on what they think is a good way to be an effective community health worker. So number one, you want to be friendly. This is very helpful, especially in the Hispanic community. It would be something that will provide a trust within you as a community health worker and the partners or the participants that you're planning to work with. You also want to start by introducing yourself and have a small conversation before you start the conversation with them. This is very important also because you don't want to just go ahead and just approach the person without them knowing you. You want to go ahead and basically open up a conversation with them and then slightly turn them into what the program is about, cervical cancer screening prevention. And then you also want to encourage women to ask questions and share their stories. This is very important because you will also create a dynamic kind of conversation with the participants. And you also want to know your material and know your terminology, such as the basics of the female body, cervical cancer, and testing methods. So this is also very important and is something that the AMIGAS program guide stresses a lot, which also provides some of the diagrams over here that we see in front of me. Some information about the reproductive system, you know, what are the parts of the human body, the basics that probably participants will want to know and that you will want to explain to them. Always try to improve your sessions. So every time that you conduct your sessions, you always want to make sure that you obtain appropriate feedback. And this is actually done with an evaluation form that will be provided to you guys. And you want to be able to be knowledgeable of your community's resources. So you want to be able to have a good understanding about what are all the resources that are available within your community that will also be available to the women that you will be carrying this intervention to. And listen to your audience. This is also very important because you want to make sure that the women feel that they're being listened to, that you do understand their concerns and that you do understand their limitations towards getting a cervical cancer screening every year. So next, to be an effective community health worker, you also want to make sure that you have a plan and that you specify the goals as a community health worker for your target population. So the AMIGAS program provides 2 lesson plans, and one is if you want to conduct your sessions in an individual visit or as a group session. So here are some important points that the AMIGAS program stresses a lot. You always want to make sure that whether you're doing your individual visit or your group session, that you always take with you the promotora instruction guide and your toolbox. So the toolbox is something that we're going to talk about all the materials and how to put all of these things together. And also, and this is over here, what are the main goals of your session? So first, you want to make sure that you explain what is a pap test. Some women may not even know what a pap test is. Discuss the importance of a pap test. Why is it important to get a pap test? They may not know that cervical cancer prevention is something that they can benefit from. You may also want to stress to them about finding out the women's current pap testing knowledge and practice. So this is something very important because you also want to gather some baseline information about where these women are at the moment when you conduct the intervention. Discuss any concerns that they may have about the pap test. Maybe they have some medical conditions that impedes them from getting the cervical cancer screening, develop an action plan with the woman, and provide information about where and how to get a Pap test. So all of these are goals that you want to make sure that you keep in mind whenever you conduct these sessions. Another important points that you also want to make sure that you keep in mind and that you speak to them about. Getting a Pap test can help women stay healthy. So, you know, every time you get any kind of screening is actually basically just to make sure that you are healthy, that there are no changes, no abnormalities happening every year whenever you get a cervical cancer screening, for example. So cervical cancer is easier to cure if it is found in time. It's important for all women to get a Pap test done. So a lot of women may think that only certain women or within an age bracket need to get the cervical cancer screening or a Pap test, but no, this is not true. All women need to get the Pap test. Women can get a Pap test in this community. You can also tell them that they can get the Pap test within their community. So for the most part, if you're already considering implementing this program, then that means that you already have a knowledge or an idea of the resources that are available to the women that you're planning to provide this information to. You want to make a promise to yourself that actually not to yourself as a community health worker, but you want to let the women know that they have to make a promise to themselves and to their family to get a Pap test. So we're going to talk about further in the presentation. So for a poll question 1, we would like to know, have you used any evidence-based educational materials to provide cervical cancer screening promotion for your organization? And we're going to give you a few seconds to respond to this question. About 15 seconds. Okay, Chantel, what were the results?
50% of our participants answered yes, and 50% of our participants answered no.
Okay, thank you so much. All right, so this takes us to our next topic. We're going to talk about the AMIGAS Toolbox. So the AMIGAS Toolbox is basically a set of cervical cancer screening education tools that you will need. And you can see actually here I have like a layout of what that includes. And this will be used to transport the information that you need to provide to the women in your community. And you may use your organization's logo to promote the health services. So here we see a little picture, like a picture of, let's say, a community health worker with a bag. So that would be an example of how you would carry these tools with you and maybe try to add your organization's logo on it. That will help promote your health services. So here is a list of the AMIGAS Toolbox. And over here you can see that it lists 13 items, which includes a combination of flip charts, body diagrams, brochures, group games. The regalitos are not included. These are optional. There are some, you can also include medical instruments, but in this case we decided to print them out instead of actually getting the physical instrument and the appointment cards. And one thing to notice here is that this is an updated version of the AMIGAS Toolbox. So I don't know if you have been able to see the administrator's guide, but that one shows an older version of the toolbox, but this is the updated version. The older version has a CD and it had some other items, but you know, as they kept on making changes to the program, then they decided to take some things out that maybe they saw that weren't necessary. So this is what the latest version looks like. So number one, we're going to go over what a flip chart is. So the flip chart contains information about what is a cervical cancer, and what is the purpose of a Pap test. It also provides information on who can get a pap test, and it provides about the information about the importance of a pap test. It gives you an understanding about who can use the education tool and how you can use it. So, you know, you will also be able to see information about how to conduct your group sessions or your individual sessions. And there's also an important tool that will help you guide your learning sessions. So over here we have an example of the flip chart. And as you can see, when you read the instructions, it will tell you that you need to get an easel binder like this, and then you would just print out the whole book and then put it in a binder this way. Okay, and one thing to notice is that you shouldn't be afraid to, whenever you are providing your sessions, don't be afraid to add your own experiences when getting a pap test. This is something that will help the women relate to you as a community health worker as well. So the next slide. So this is an example of something that is included in the flip chart. So you can see here that the information is provided in English and Spanish. So for example, if we go over one of the pages, it shows who should get screened for a pap test. So then at the bottom, it will tell you the information that if a woman, that this can be done on women ages 21 to 29, and also that they will be screened for an HPV test every 5 years. And the information is also provided in Spanish. And one thing to know here is that all this information should be read out loud to the women during your sessions. So the body diagrams, they show the female reproductive system and how a pap test is done. And this is very helpful because it provides it's like a visual aid for the women to have a better understanding about what it entails to have a pap test. So here we have, for example, this one here. Thank you so much. This is a diagram of the body, and the information is provided in English and Spanish, and the labels of the reproductive system are also in English and Spanish. So this is very helpful. This would be something very useful for you as a community health worker to use. Okay. And this is another diagram here. And in the instructions, one of the things you will find is that these should be laminated. So sorry for the glare, but we tried to follow all the steps to try and do it exactly how they say to do it. So this one provides information about how the pap test is done. So maybe some women don't have an idea on how this is done, you know, so you can explain to them, you know, look, you will be laying down on the bed on the clinic, at the clinic where they will be providing the cervical cancer screening or the pap smear, and then this will be a doctor, and then a nurse will be next to you. So one of maybe a concern that they might tell you is that what if my provider, the doctor, is a male? So you may want to tell them, look, they're professionals, you can trust them, and there's always going to be a female nurse next to you so that they can feel more comfortable during the procedure. Well, it's not a really procedure, but during the test. Okay, so now we're gonna go over the contact sheets. So these are very important because these provide information with this, you're going to be able to gather information of all your participants. You want to make sure that you always give them out and that you have them fill out as much as possible. These will help you also keep track of the conversations as you go with the women, as women get closer to getting the regular pap tests. And also at the bottom of the contact sheet, you also see a section that is actually only for your use and your program use. So this is where you will write your notes every time that you see the same participant. you will also want to make sure that you keep basically like your own progress report there. Okay, so our message cards are right over here. So these are this is a very unique tool because this is based on the information that was learned from previous experiences from some of the Latinas that they obtained information from whenever they did this intervention previously. So in the front part, it will show you what a woman might say. And then in the back side, it will show you an example of what you can say as a community health worker. And during the AMIGAS guide, it will tell you that you will need to be creative when using them. These are not provided in Spanish, so you may have to like do some translating. Let's say if they don't understand English. So for example, in one of the cards it says, I do not need, let's say the participant says, I don't need one. I am too old to get a pap test. Then in the back, you can say that that is not true. All women can get a pap test, and this includes older women too. Okay, so this takes us to our next poll question. And we want to know about what are some possible barriers you think may influence Latinas in your community from getting a pap test. Out of the 4, which do you think is a major reason why? And we're going to have 15 seconds to answer this question. Okay, thank you so much, Chantel.
All right, so roughly 100% of our participants voted for health insurance.
Okay. All right, that's good to know. Actually, that is a very, very good analysis because here we're going to talk about in our next slides about how to go about into how to give them more information about insurance issues. So next we're going to talk about a research sheet. So a research sheet is a specific per promotora because every promotora is going to be focusing in one area within their community. So the information provided here will vary depending on the location where the program will be implemented. And this is a tool that you will want to go over with your participants very carefully because you want to take into consideration where they live, what type of access to transportation they have, whether they have childcare, all those things. And you also want to make sure that all of the information is current. So next we have an example on how to fill out the research sheet. Here we have an example of Yakima Health Center in Washington State. 1 second. So if you see here, they have provided information about all of their satellite, out of their sites, and also provides information on whether they speak English and Spanish at that facility, their bus route, the hours the hours of all of the facilities when they're open and when they're not, whether they also have a call center that is probably open 24/7. And also they also have some, provide some information on health insurance. So here you will want to maybe include maybe a program that your health center provides to help these women have free cervical cancer screenings. There are some programs out there, but you know, it varies depending on your health center. Okay, so the appointment cards, they're very straightforward. It's just like any other appointment card that you receive from a health center, but this provides the women just information, and it serves as a reminder for them of when their next pap test is due. And then in the back of the card, it has information for them, such as like what things they need to keep in mind, like their transportation, directions to the clinic, whether they have a Spanish-speaking doctor, or whether they have childcare services, and some other advice in there. So the medical instruments, like I mentioned earlier, these are not really necessary, but you should use them if you think that the participants are going to benefit from seeing these instruments, then you should go ahead and use them. I know that in some health centers, or let's say for us as sometimes as consumers or as patients, we may want to have an idea of, okay, you know, what is my doctor going to do, you know, during my procedure or something. So, you know, sometimes maybe using them so that they can be more familiar with what they're going to use, and explaining them to them that, for example, what is a cyto brush? That a cyto brush basically only takes some cells from the cervix for sampling. Also explaining to them what a speculum is, and maybe showing them what it looks like, and that is just an instrument that is used to open the walls of the vagina so that the cervix can be seen clearly by the doctor. Okay. And these are other optional items that you may want to take into consideration, but I think the regalitos and group games will be a useful tool to use, mostly because it will provide a dynamic and fun experience for the women whenever you conduct these sessions. So regalitos are, you know, to thank women for taking their time to meet with you. They also serve as an incentive. And also other incentives that you can use are prize raffles. And like I mentioned, they're not as necessary, but if you think that you may benefit, your organization may benefit from using these regalitos, and that the women will also find these regalitos, you know, useful for them, then your organization can budget for regalitos if you do decide to use them. Group games are to make the learning sessions a dynamic and fun experience, like I mentioned earlier. And examples on how to use these group games, they're in the promotora guide. So there, you can see that there are like different options of the games depending on the group sessions that you plan to carry, all that stuff. So here we see the promise sheet. This is a very unique, and I think it's actually one of my favorite tools from the toolbox, is the promise sheet, because it provides, it's basically a commitment tool for women that shows the specific actions that they will take towards getting a pap test. It will present the next steps according to each woman's action plan, and then it also includes a date by which she has agreed to do the actions by. And it will also always remind them that getting a pap test is something that will be done for themselves, and is also indirectly is also done for the benefit of their family, because if they're able to always get screened for cervical cancer, then, you know, the earlier every time whenever they keep being healthy, then they can also stay healthy for their families, but not only for themselves. And then also it serves as a reminder that getting a pap test is something positive, is not something negative. So that is something very good about this promise sheet. And it's also provided in English and Spanish. So the AMIGAS handout is basically a one-page take-home information sheet. And we have them here. So basically on one side it's in English, and on the other side it's in Spanish. And you also want to make sure that you print enough copies of these AMIGAS handouts, because you will not only give it to your participants, but then your participants will also take a few copies so that they can share it with their friends and their family members. And you also want to make sure that you include your information at the bottom of the form so that they can contact you. So here we have the evaluation form. This form is very, very important because it will help you gather information about how your participants feel about the program. It will help you gather feedback from the women in the community. It will help you obtain information on what are the areas that you may need to improve whenever you conduct your sessions, and should always be given at the end of each session. So whenever you do this evaluation form, you want to make sure that you also go over each item with your participants, just to make sure that they do understand the information in there and that they do understand what they're being questioned. I believe that this is also provided in Spanish, but if it is, I'm going to go ahead and add it to our files on Moodle. But for now, this is on in English for the presentation. And this takes us to where you can access these tools. So I tried uploading all of the files on GoToWebinar, but there's a limit up to how many items you can upload. But you can find all of these tools in the PDFs and print them out on our Moodle account. And the link is here provided. Okay, and then now we're gonna go on our Q&A session. You have any questions? And Dr. Leon?
I believe that there are 2 or 3 items that we can highlight. The very first one is the fact that the healthcare worker needs to be very friendly and listen carefully. Sometimes, or not sometimes, most of the times, patients need to be heard, and that helps. That it will, that if you listen to your patients attentively, that will create an atmosphere of trust, and the patient and the person in the community, or the people in the community, will start to trust you as a person who can provide some of the health information that they need, and sometimes they don't like to talk to other people. The other topic that was mentioned that is very important is the fact that even though the speculum and the brush are optional, it's a good idea to have them if possible, or at least to have a chart showing them, because it creates anxiety. Every time that someone is going for the first time to have a test, and if the person doesn't exactly understand what this test is about, is going to create anxiety. And if the person has contact, at least have some understanding of the instrument that are used, then that helps to decrease the anxiety. The other item that was mentioned that is very important is that, and it's also regarding to the anxiety piece, is that remember that some patients are going to have the test for the first time. And when you have a test for the first time, I mean, you are anxious, and that if you have the materials and you have a very good conversation and if you listen carefully, that is going to decrease the anxiety, and it will help the patient, to accept the screening. So those are the kind of information that you need, or the key topics that you need to keep in mind. So it makes your interaction with your patients effective. So those are some of the good options that you need to keep, or some of the good items that you need to keep in mind, as well as some of the questions that were mentioned. Patients will have all kind of questions, and even though you probably are not going to have an answer for each question, the materials reviewed provide answers to most of the questions. Remember that this intervention has been tested multiple times. So those questions are based on the responses that the reviewers and the researchers have gotten from the patients. So any questions in the queue?
No, we have no questions at this time.
Okay. Well, I believe that this is something that you can put into practice. I understand that most, if not all, of the attendees have a large Hispanic population. Unfortunately, and one of the caveats of this training is that CDC doesn't provide printed materials. So all the materials need to be downloaded from the website, or you can go to Moodle and get the documents from Moodle, and then you can print them. It will require some expenses, but the materials are very useful and they have been tested, and it's going to be a great help if you are planning to adapt or to start a cervical cancer screening program. There's something else that I would like to mention. The National Center for Health and Public Housing will host a conference in the month of June 2020. Cervical cancer is going to be one of the topics that we are planning to include. So if by any reason you would like to participate, or if you would like to share with us your experience after putting into practice this kind of initiative, send us your abstract. Go to our website, www.nchph.org. The call for abstract will be posted soon, and share your experience. Share your experience, share what you're doing for your patients, and let other health centers know what you are doing.
Do we have any questions so far?
No, we do not have any questions.
Okay. Okay, and then next, we just want to make sure that we remind you to please join our mailing list and receive HRSA updates, Medicare updates, funding opportunities, information about senior programs, resources and services, and all of the recordings and slides and resources provided from our webinars. Okay, and also make sure that you visit our website at nchph.org to have access to all of our materials, such as webinars, monographs, publications, interactive maps, provider and resident center fact sheets, training manuals, newsletters, annual symposiums, such as the one that we have coming up next year in June from June 18th to the 19th here in Alexandria, and any information on one-on-one trainings. And here is our contact information. Thank you so much.
And we are going to have our next session next week. So if you, in the meantime, if you have any questions, you can send your question via email. You can contact us. You can go to our website. You can go to the platform that was mentioned, and let us know what your experience is. Do we have any post survey?
Yes, we do have a post survey that we encourage you to fill it out, please. That will help us improve anything that we need to improve with our presentation, and will also help us obtain some good information about your knowledge based on this learning collaborative. And also just want to remind you that our next module is next Wednesday as well at 1. And on that module, we're going to learn about how to use the AMIGAS Toolbox. We're actually going to do a mock learning session an individual, like how an individual visit will look like. And we're going to go over about some of the challenges that may arise in the field of health promotion and discuss the basics of cultural competency. Anything else?
No, once again, thank you so much for participating in this activity. We are very close to the holidays, so happy holidays. But remember to participate next week, next Wednesday, so we can go over module 3 on all the learning objectives and how you can use the materials that were just presented in this session. So thank you so much and have a great afternoon.